We should should we do some vocal exercises?
Maybe we should.
Because I'm new to this.
Sometimes we do.
Are we recording there, boss? Awesome. Okay. Welcome, Dr. Jackie. Thank you. We have a doctor in the house tonight. Super excited. It is episode 13 to our podcast.
Lucky 13.
Before we introduce our lovely guest, I do want to do a little bit of a trigger warning. As you guys know, we do different medical things to advocate, and today we are talking about childhood cancer as well as navigating the medical system. Saying that, I think it's super important to talk about these difficult things because they happen more than we know, and the more we talk about, the more people can become aware. So again, we appreciate you here, and
thank you for coming.
Without further ado, we will let Dr. Jackie take the lead in introducing herself and maybe telling a little bit about what she does for a living.
Okay.
This is the awkward part that I was telling you. All right. That I'm like, it's only 5 seconds that will be awkward, and then the rest is good.
And then we get into it, and then we forget where we are.
So I'm a naturopathic doctor, and I'm also a doula, I guess is my career as far as that goes. And then I'm a mom of 3. So I have 3 boys at home. And what do you want me to tell you
so
about
I would love,
this?
I would love to know. So I didn't know you were a doula. So that's super cool too, because we just recently had a doula in, as we mentioned before. Yep. But I would love to know what brought you into this type of field and
what is a naturopathic doctor?
Yeah. So what is a naturopathic doctor? And we'll start from there.
So a naturopathic doctor is a primary care practitioner.
Yes.
In Ontario.
Yes.
After doing 4 years of undergrad, I did another 4 years at the Canadian College of Naturopathic Medicine. So I graduated in 2010 and started practicing at that point. In terms of primary care, naturopaths can do things like physical exams. They can run blood work. They can sort of act as your family's touch point in the healthcare system. There are certain limited aspects to that scope, but
because you did the time, right? You did 4 years of the general, and then you went into specialized.
Yeah, that's right.
Okay.
So
it's a lot of school.
It's a lot of school. I think one of the main differences, obviously, is it's not covered by OHIP. Yeah. So most people who have access to naturopathic care usually do so through having extended healthcare benefits.
Right.
But the nice thing about that is our visits are long. A first visit is usually up to an hour and a half potentially, and then follow-ups could be half hour. So there's just a lot more opportunity to be more thorough, more holistic, personal, develop relationships. Those are the things I think that really drew me in that direction.
Yeah.
I was on the path to wanting to be a medical doctor and was at that point of getting all the requirements ready to go to apply, and then just something redirected me, I think, intuitively.
Yeah.
I just sort of decided that wasn't my path. And then I found naturopathic medicine. I saw a naturopath in my last year of university.
Wow.
And that really just set me on this course of this is where I feel I'm going in the right direction.
Where you're supposed to be.
That's right.
And it's so incredible because this is something that I'm very much interested in. I've heard some of my friends have sought out this type of care, and somebody who, has struggled with mental health a lot of my life and kind of in the medical field for the last 4 years, even prior to Gwendolyn. I always was kind of interested in the other side of things. So again, that's why I think we're so excited to have you here as well.
I have a lot of questions.
Yeah. So how would you compare yourself though?
I want to know, first off, when you made that change and you decided that was the path for you, what kind of lifestyle were you living at the time? And how has your lifestyle changed?
Because I'm all here, I'm essential oils. I'm give it all to me, all natural.
And I'm red dye 40.
Stereotypical thing.
Fruit Loops for breakfast.
Yeah, I'll call her. I'm just having some cookies
I'm a good mom
now.
Though. Yeah.
But what was your lifestyle then? How old would you have been at that point?
I was 22,
I
guess.
Wow.
Young,
because I was in, university.
That's
my
so
lifestyle
young.
Wasn't necessarily
reflective
super. I mean, I was healthy in my teen years in high school. my sister and I both ended up had eating disorders
Okay.
to varying degrees. So I feel
Thank
like
you for
there was,
sharing
like,
that with us.
Yeah, you're welcome. So there's like a high focus on nutrition in the recovery piece.
Absolutely.
Of that. And
Yep.
so I think that sort of guided me to just being very conscientious about food choices in university, but it wasn't like a super focus. Like health-wise, I was going out a lot. And
like a normal student.
normal
This is what you're supposed to do during those times.
That's right. Yeah. I would say I was very like new and green to a lot of the like stuff I was introduced to once I became like
which is kind of exciting to be able to really like kind of go in with like fresh eyes and
and I feel like nowadays we're so much more aware of our health compared to when you would have been kind of branching out into that field.
But I feel like it's less accessible now, which we'll talk about later probably.
We'll get to that.
But what was your question that you just had that I interrupted?
Oh, it's okay. You do it all the time and it's fine.
I think the other thing I was just going to say too, as I'm like thinking back on my journey, was that I had started off in biomedical sciences and then very quickly realized that that was like too heavy into the sciences for me. So I was able at Guelph to switch into a Bachelor of Science that was psychology major.
Love
so
that.
then I kind of had this like balance between the, you know, the psychology component balanced off with like those sciences. So I was kind of already finding this middle ground between the two, which is what I ultimately love about naturopathy, is that there's like this art to practice and there's a lot more like creativity in terms of like
it's a
what
lot of
remedies are you going to choose, and like homeopathy or acupuncture or
and again,
medicine.
like we're learning that everything is kind of attached to like the cognitive side of us, right? Like our big, beautiful brains, but they can really, what is the word that I'm thinking of? It can really, if we're stressed, that can show in not so many other aspects as well, like physical aspects.
That's right. It's like the mind, body, spirit.
Absolutely. It's not just the physical part anymore. It's mind, body, and spirit. That's exactly it. So how would you compare? So I guess you kind of answered a question, how you would compare yourself to other doctors is, again,
just having the creativity, having different, obviously different approaches though. Like it's not obviously like a medical approach in terms of writing a prescription, right? You're looking at healing the body and the mind in natural ways.
Yeah. I think one of the big components to naturopathic medicine, it's one of like our tenets and principles, is to identify the root cause. And so the root cause, you know, you're not just trying to find Band-Aid solutions, like this medication corresponds to that symptom.
Yes.
You're looking for what is ultimately the root. Yes. So is that root like nutritional? Is it the gut? Is it lifestyle? Is it a stressor or a traumatic event, right?
Absolutely.
Right.
And how these things then like unfold in people's lives.
Physical symptoms.
Yeah. I believe pretty much every symptom does have a connection to a mental emotional component.
For sure.
Yeah. When you are practicing, do you find that, because obviously you have the doula work as well, I'm not sure how much that overlaps with the naturopathic side, but do you find that like the main reason people are seeking you out is mental health related?
Not necessarily. I feel like that usually kind of becomes introduced throughout the course of like our first interview. Like usually there's some, you know, problem spot that someone has, like their chief concern, that brings them in. And then as we go through like that interview, their story starts
You're kind
to
of
come
stripping
out.
away that onion, like the core, into the core of everything.
And I find like perhaps with me in particular, or perhaps it's like the type of practice, like the vibe I put out for people, it's like there's often tears at some point in like the first, because it might be the first time that someone's even shared their full story of like, you know, their healthcare journey, or they felt they hadn't been heard out by a practitioner to date, or there's something really stressful happening in their life at that moment that, you know, now they have a voice to share it. And, you know, not
again, that
accessing.
it's more personal, right?
Do you find that you get emotional with patients?
Yeah.
Yeah.
I do.
Yeah.
Maybe that's why you're so approachable, though. Yeah.
Yeah, sometimes I don't know if it's like a good thing or a bad thing. Like I think it's
a
good.
wonderful thing.
Ultimately, it's a human
You're an
thing.
empath.
Yeah. It's an empathic trait, and sometimes it's, you know, perhaps feels like there's yeah, I don't know.
I mean, my
There's
therapist
connection.
cries with me every time, and she's like, "Again, I'm sorry. I knew this was gonna happen." I'm like, "Girl, you cry with me. Like, let's just fucking cry."
Yeah.
I feel like I was going to say I might cry today. I don't know.
I actually, I don't think I put did I put mascara on tonight? Because I was like, I'm probably gonna cry into this. Katie doesn't cry enough, I don't think.
No.
And I'm just like, cry with me.
I have a really good
just
sense
let it
of
go.
humor, though.
That's a great coping strategy.
I was just going to say that's a coping
well.
strategy. Yeah. But I love how you said a bandage, because a lot of people don't know that, you know, they can ask questions, they can seek different routes, they can advocate for themselves. If they're not happy with someone, they can essentially seek somebody else, hopefully in a lot of different cases. And I think sometimes in the medical setting, they just, you know, take the easier route where, no, let's investigate further. And I've just was dealing with this with my dad, actually, because he's actually fighting an autoimmune right now that showed itself shortly after Gwen died. And again, a lot of the time I think, well, was it the stress that we were under that maybe brought this autoimmunity to surface? And the last hospital admission, I said to them, you know, what can we do here? Like, I'm tired of masking it. I want to not only manage it, but I want to also see if there's something that we can do to help with the flare-ups, you know, to treat that. What is an alternative route? Be proactive instead of just bandaging it. And then, you know, then I got some answers. Well, there's this government funded thing. And I'm like, well, let's fucking do it. Sorry, I swear a lot on this podcast as well. But again, like, let's do that. And I think, you know, we'll talk about that later with you and your situation as well, but knowing that there are other routes as well.
Yeah. I think the way our system is kind of designed is to essentially be the most efficient it possibly can be.
Yes.
They're
and like
trying
appeal
to see
to masses.
In and out, right? Yeah.
Yeah.
Absolutely.
And I'm sure that is very frustrating to the practitioners themselves as well, right? When they might know that there's more that they could access or more they could do, but they just don't have the time.
They don't have the time, and they're not supported as well either. Yeah. And I think that's the reality of our healthcare system right now, is they just don't have enough supports.
I have two really good questions.
Go ahead.
The first question is, the first question is, I guess, because we're on this topic, do you ever work in cohesion with like family doctors or other people in like medical fields? I know you said that you can order blood work and you can do certain testing and things, but do you ever work as a team being a naturopathic doctor?
Not me personally, not for any specific reason, but I would say there are some clinics that exist. Like I was practicing in the GTA before moving to this area, like a more rural setting. So there's certainly some like more integrative clinics where you would have like conventional medical doctors working alongside naturopaths, and they work like as a team. And so in those situations, it can be really smooth and awesome for patient care, especially. I think the style of practice that I have, or the patients that I serve, that relationship hasn't been as necessary.
Right.
But there have been occasions where like I've been asked to kind of like communicate something to a physician, or what I'll just do is kind of like prep the patient as best as I can to kind of like say, well, this is what I think we're looking at, you know, as part of your like diagnosis or your symptom picture, like to bring to your doctor and like discuss it
too.
Yeah,
absolutely.
Yeah.
Absolutely.
The second part of it, and it kind of asked like if it was like always like a mental health focus, but what are some of the common things that you're finding that you are able to treat successfully in your practice?
So yeah, that's a great question. I feel like a really big one when it comes to naturopathic medicine is like the gut and digestive health. And
because I see all the time on Instagram that like everything is like
everything's connected to the gut.
Yeah,
it is.
Because isn't there a fancy thing that is connected from the brain and runs like, what is that?
The vagus nerve?
That's it. Doesn't it kind of flow right through into like, that's why we feel a lot of anxiety in our chest. Yep. And that's when we're really stressed, we're like, oh my God, I feel like I'm going to crap myself, because it's like your digestive system, right? And
they're like basically directly linked. And then there's also like the fact that your digestive system produces certain hormones like serotonin. So again, like, so there's that. So the gut is huge. It's also like, you know, where we intake food, and if we're not digesting properly, that can lead to all kinds of issues. It can lead to autoimmune conditions or allergies, and eczema. I mean,
And
this is
there's
something
also,
that
like-
we see as naturopaths. There's some discrepancy potentially with root cause
Yeah.
and the medical
Maybe that's why,
field.
like, when I eat a lot of chocolate, my face breaks out. Would that be maybe what, like my hormone,
Sugar?
you know? Yeah.
It
yeah.
can be like hormonally driven. It could also be related to blood sugar. And like,
Yeah.
that's the other interesting piece about, being a naturopathic doctor is sort of like each person, will have a different root cause.
Absolutely.
It's like you
It's not
are
a
a
one size fits all.
detective.
Yeah, it is
It's
a little
like,
bit like
like all
being a
your
detective.
patients are a mystery, and you have to like find the clues and like.
Well,
like any
treating them like
doctor, but you
individuals,
are,
right?
yeah.
Because
but
each
I just
person
like
comes
I
with
like
their...
that analogy. I think that's
and not
more
putting them
Yeah.
into a category.
That's right.
I
Yeah.
love that. That's so cool.
Yeah.
Okay.
I feel like another big one would be stress, like stress and
Yes.
adrenals. Like adrenal fatigue is a common term.
Yes.
I heard that you're
Like burnout.
they can get what was it that
They're on like hypersensitive for so
Yeah.
long, and then all of a sudden they burn out essentially.
I forget exactly what I was told, but yeah, how it can like affect your whole body, and then you're like constantly like cortisol. Is this making sense?
That's making
that
sense.
thing that goes
Yeah.
around,
It's making
the
sense.
dopamine.
It's sort of like when you're under chronic stress, your body just can only keep up for so long.
Oh
Yeah.
yeah.
And you're compensating, and then at a certain point you're not able to compensate, and so things start to like break down,
And that's when burnout
your window
comes
of
in.
tolerance to cope with stress will start to diminish, and you can start seeing the physical toll.
Did you just recognize that word she just used? Window of tolerance.
Yeah.
I just learned this in therapy the other day because my dad was just admitted to hospital. He's home now, but it really sent me into a grief burst. And my therapist was explaining window of tolerance, and we all have that window of tolerance. But when Katie does this to me, she's prompting me
see
to
you.
move my head.
Just trying to see you. I'm just trying to sneak a peek every once in a while.
So, and she explained to me that everyone has a window of tolerance, but somebody who suffers such an extreme event, their window of tolerance
Shrinks.
diffuses or shrinks essentially. So you either feel so much or you feel nothing, where you're disassociating.
Yeah.
So that's interesting too.
Super
Wow.
interesting.
I knew I was going to love you
Yeah,
on here.
the physical side of things, there's like supports for your adrenals, and like
Yes.
learning how to like cope with that stress on like the physical side, so that you can tolerate stressors better
Yes.
and cope more effectively, I guess.
What do you think is the best general advice to give somebody for living a more healthy life? Do you know what I mean? Like, is it getting better sleep? Is it managing stress? Is it like one
Eating,
thing?
is it?
Is it?
I think it's a mix of
one
both.
thing. I feel like stress is probably the biggest one that just like
Interesting.
encompasses everything, and all those other, foundational things like your nutrition, your sleep,
Yeah.
your water intake, all of those things are supportive and necessary. Exercise and movement. But
I feel like that goes sometimes hand in hand with stress though, because for me, so I experience a ton of anxiety. And I talked to somebody today because I was feeling really anxious today. And they said that they would never know that from me. So I hide it well. But I feel like when I had anxiety in the past, it affected me so differently than how my anxiety affects me now, where I would not eat. I'd feel really sick, where now I get stressed, I binge eat, and I just have like all these symptoms of my anxiety now manifesting in really physical, like unhealthy ways because of stress.
Yeah.
Right. So you're right that that's maybe like the root, and how like if you manage your stress, then maybe I'd want to like not eat a whole box of Oreos or whatever that looks like. Right. And I feel like that's all stress driven for me personally.
yeah.
I feel that too. If I feel like shit, I want to eat like shit.
Yeah. Or just
the wrong
like,
thing.
or self-sabotage, right? Like if you're not feeling well, I don't know. I feel like stress is a big one. So okay.
It's a big one. It's also like, I just want to say, like, it's so easy to say, reduce or manage your stress. I feel like even before that, a lot of people don't even know that they are stressed. There's like a huge disconnect that many people have, where their brain and body are like disconnected. And so they're not necessarily connecting the dots that they are stressed, even though they could list, lots of stressful things. They might feel like they're doing fine.
I feel like everybody's stressed.
Yeah. Yeah. We live in a like high stress
Notification,
society.
I know that I'm
Yeah.
stressed. So.
Yeah.
Oh, hello.
I know that I'm stressed.
We have not even, we need to move along. My goodness, there is so much we need to talk about. So, so that's just the beginning of everything for you. And I want to bring in how being a mom who is a naturopathic doctor and receiving a cancer diagnosis of your youngest child. Can we talk a little bit about that?
We can.
Okay.
Yeah.
What's your youngest son's name?
Spencer.
Tell us all about him.
Cute.
I love him. I follow you closely on Instagram, and he is the sweetest little thing.
He is very sweet. So we have 3 boys. They're 10 and 8, and then the little 2-year-old. So we had a big gap between the older 2 and the younger one. He was kind of like
Was he a pleasant surprise, would you say? Or
no, it was like an opening the window. It was like I toyed with the idea of a third for quite a while, but felt very stressed with 2 under 2. And like, just like that very took close. Me a while to kind of just get used to. And then, COVID and lockdowns and
your career.
Yeah, right. There was a lot going on. There was a lot going on in the last 10 years for our family, but it was like, okay, if we're going to do this, like, let's just give it an opportunity of like 6 months and see what happens. And then there he was at the last minute.
Okay.
And so we moved from the city to the country.
Okay. So you're
during my pregnancy.
You're new to here then, Rev.
Yeah. So he's my only local child.
Okay.
Technically. And yeah, everything was great. Like I had 3 home births. He was another like home birth. There was nothing unusual about our the pregnancy or his first year. And so just around like his first birthday though, he did start getting sick, and I attributed it to him starting a home daycare.
Okay.
Kind of like this typical.
Which would absolutely
building our immunity.
make sense.
Yeah. And I also thought there was components of just like, he didn't want to be away from me. So he was like quite clingy, but it was almost like, funny. I'm like, okay, another Tuesday rolled around and like, here he is. He's like not well. So it was kind of like going up and down.
You see a pattern.
Yeah. Started seeing a bit of a pattern. I don't know how detailed you want me to get. But
No, whatever you want to share, we are extremely open.
I had never really had to take my kids anywhere. Like I've never been to the ER except when my son broke a bone. But like we had never been to like urgent visits. I felt quite comfortable in my training to do and take care of almost everything. So on Mother's Day, I remember I did have to take him in. He was having like a lot of like respiratory stuff. So he was sick, like quite sick, and I felt really nervous. So that was experience number 1. And so then his health just kind of like continued to go up and down. And by, I guess it was June, so he 13 months ish.
Okay.
My friends were very involved. Like I have a lot of friends who are sort of in my like colleagues, right? So I'm consulting with them, being like, this is just odd. This pattern of symptoms is like very nondescript with leukemia. It's like fatigue.
Okay.
Kind of just unwell. There were some other things that maybe started making me think like there was maybe something immune going on. He was reacting to mosquito bites and getting huge welts.
Okay.
He was quite pale, started bruising a little bit, but not a lot. Okay. So those were some signs that I didn't notice until after his diagnosis. The day he got sick, it was just like a sudden decline. And apparently this is not an uncommon presentation. He was just extremely lethargic that day. I was managing him at home, and a friend came by. She brought me a sandwich and
just
was
check
like, felt like she needed to check in. And I was like, I'm good. And and then when I passed him to her to like go to the bathroom or something, I finally saw how weak he was. Like his eyes were rolling back in his head. He could barely hold his head up. Yeah. And I was like, do you think I should go to the hospital? And she's like, I think you should. I think you should. Yeah. So she offered to take my kids home that day. My husband's on a work trip. Yes. Got him to Picton ER. Yes. And they did blood work, and they were alarmed like that he had a very he must have a very bad infection, but he didn't have a fever. So I was like, this
isn't making sense.
It wasn't making sense, but I was also just unaware. Like
absolutely.
Yeah. They started giving him fluids. He perked up. I was like, this kid is fine. He's just been dehydrated because he's been so weak, and he was still relying on nursing a lot. Anyway, next thing I know, they're like, we're airlifting you to CHIO. And I was like, that's when like probably my first shock, when I was just like, I don't know what you're talking about. We can't get airlifted to CHIO, right? Like go all the way to Ottawa. And I'm thinking like, my husband's on an airplane. I can't be in Ottawa.
Yeah. Wow. So were you able to communicate with your husband at this point, or was he on flying himself?
He was flying. I was texting him, and he was just like, what's going on? And so luckily, in the end, the helicopter couldn't meet us. The helicopter was going to meet us in Kingston. So we did like lights and sirens to Kingston. Yeah. They sent us with a doctor and a nurse. And all this time, I feel like it was very surreal. Like I wasn't connecting the dots.
Maybe you were just starting to, in that shock, your brain was like immediately like, okay, we're going to tap out.
And I was looking at him and I'm like, he looks stable. I'm like, why are they sending a doctor?
Why are we doing this?
Must be a very expensive like ambulance ride.
Anything up until that point?
They just said his white blood cells were high. And so they like thought infection. And I don't know that they could give any further conclusive kind of indication at that point. So anyways, we get into Kingston. They admit us right away and we're waiting there, getting things going, like the blood work and more testing is happening. And then just before midnight, they introduced me to an oncologist who comes in the room. And again, I was very much like, my brain was just like, why would they be bringing an oncologist?
Yeah, you're almost so like, why the fuck are you here?
Yeah.
What is it?
Like in denial almost.
Absolutely.
I was in super denial with Owen when we did 2 hearing tests that he failed. And then we went to the sedated ABR and I was like, he'll still be fine.
Yeah, he's fine.
Yeah.
He's fine.
So denial probably was.
I think so. Yeah. Like a checked out kind of. And, I'm just holding him and my husband was like imminently going to arrive, but not there yet because he was driving from Toronto. So she sits down with her stack of papers and she's like, Spencer has leukemia.
Just like right out?
Yep. Just right out, which I don't know that there's really any
way else to tell them.
Way to say it. And it was shocking. Like
Absolutely.
Yeah, like, how do you process that?
I guess, I had to, they didn't stay long. It was quite late. It was like more in the morning.
Oh my gosh, yes.
Chemo will start. Further testing.
Wow. So all of this in less than 24 hours essentially are almost just brinking. Like, had your friend over, went to the hospital. Yeah. Drove to Kingston via ambulance, sat down, more tests, and then all of a sudden an oncologist. And now we're starting treatment ASAP. How is one too supposed to digest all that in that a matter of time, right?
Wow. Yeah. And so I think... then I had to call my husband because he was just like, what's going on? Yeah. And so I told him over the phone. It was all just like really shitty in terms of like having to
into a shitty situation to begin with.
Yeah. So then I think once he got there, we just, spent the night like in tears.
Absolutely.
Staring at each other.
Yeah. What do we say? Like you just feel, and I think we talked about this prior, is surrendering. Like when there's something so out of your control, that's the surrender piece.
Yeah. I don't know that I was there yet that night. Like all I remember was just in my head kind of like calling out into like the abyss. Like I can't do this. Like, I can't do this. Like,
there's no way.
Yeah.
And you're almost, I remember when I got the diagnosis of Gwendolyn and her, I don't know if you know this, but my daughter was born with esophageal atresia. So it's essentially where the bottom of her windpipe is connected to her stomach. So like her esophagus isn't attached. So, and again, normal pregnancy, nothing was caught. I did go early. Whether that was the case or not, nobody knows. But receiving that diagnosis and again, you're just tapped out and you're like, I'm fucked. Like there's nothing else I can do. And then Google happens and then this happens and then more and more and more of that happens. And you just kind of have to sign off these papers. Yeah, I'll sign off there, sign off that. So when they said we need to start cancer treatment, that's a lot against your school of practice. The scientific part, would you say it's kind of...
I feel like I knew how sick he was.
Absolutely.
And so there was no question that we were in the right place.
Yeah.
I think he improved. There was a lot of it was touch and go at the beginning. Like he was quite ill when he arrived. Yeah. So getting him to the point that he needed to be was like those first several days where like he was in critical condition. And so I accepted that, although, that chemo was kind of the only thing we were going to do because there's nothing else we can do. And
at this point, yeah.
Once it gets to that stage where it's like this slow progression and then the sudden drop. Like that means their body is quite full of like these leukemia cells, which are producing tumors like all through the body.
Oh, wow.
Because it's a blood cancer. So
Yes.
it's a little different than like a
Absolutely.
solid mass. So that was, I mean, what was the hardest part to wrap around was like, I remember the nurses coming in the next day, and that's when we kind of had this discussion of, you know, this is the treatment. Chemotherapy is mandated in children in Ontario, like under 18. And so I felt like there was like these little hints kind of dropped that perhaps because they knew I was a naturopath, that maybe I would be more
Like
resistant or try to seek
Other roots.
like what would I be doing? I think in comparing notes with some other parents, that may have been the case, like that it was unique to me to hear those.
Because I feel like they may have been a little bit intimidated by you, like maybe, I mean, you know your stuff essentially, and
I was also probably, excuse me, my tummy.
that's okay. It's a little growl.
I was also probably a bit defiant. Like I even remember admitting to our oncologist, who I do love, you know, after we finished our first year,
Yeah.
I was like, I low key hated you. I regret saying those words, but I felt that I hated her. I hated how the news was delivered. I hated how I had to find out alone. I hated that we had to do chemo. I hated just everything about it. And I was kind of like,
You could place blame as
yeah.
well, right?
So I was maybe like also a little bit prickly
Absolutely.
with the nurses and stuff at the start.
I feel like I would be
I would
too,
be angry.
just
You're
going
angry.
through that situation.
Yeah.
Like it's really intense emotions, and I feel like
You want blame. You have
how
no
can
control.
you go through that positively
Yeah.
or happily, or I don't know, I would be like still in denial.
I think with any medical diagnosis, like you as humans, we want to have control, and when we don't have control, we want to put blame on
It's
someone, and you
frustrating.
just don't. There's none of that. So that's fair.
I think I questioned too, like, should I have gone in? Could I have, like, could we have, I don't know, just
Could
all
things
those
have
what
been
ifs, or
different,
should I have,
right?
if I had come in earlier, would this not have been, you know,
Again,
all those
the
things,
control.
right? Just-
Yeah.
Yeah.
There will
Oh,
always
But
be
you are where
what
you
ifs.
are. And
Yeah.
then the
So
ball, like
he's-
the train left the station.
Yeah.
Yeah, he's done a year of chemo. Is he?
Yeah.
Is
Yep.
he in? Like, is he still participating in chemo right now?
Is he a
Like,
what
what's
human?
his what's his health? Like, is
So
he?
is he participating?
Oh,
is
yeah.
he still like
Participating?
taking
Like-
part in
Yes.
the treatment?
Whereas
Yeah.
Like, what does
today,
that look like? Like, let's start at the beginning. Like, what? So you walked us through shock, and now so we're receiving treatment, and you were admitted. How long was the admission for? What
And did you
happened
go to
next?
CHIO?
Like, did you have to go to CHIO?
Never had to go to CHIO. CHIO was because his kidneys were in like kidney failure ish.
Okay.
So they were just communicating with, they didn't know if they needed dialysis. So they determined that we could stay, which was amazing because Kingston was a much preferred, smaller, friendlier, closer to home hospital.
Yeah. And what a blessing that they are so close.
Yeah. So that was all really good. And so those first few days, again, they were quite touch and go. It was all based on the kidneys. The chemo started right away. And with leukemia, the goal is to get them into remission within the first 28 days. So it's called induction
That's big.
chemo.
Wow.
Yeah. And they do some like genetic tests, and they do like lumbar punctures to determine if they get to that at the end.
Yeah.
And so that's like a promising kind of like diagnostic marker. If he responded well to treatment in the first 28 days. So he did. We were in our first admission, we were there for 14 days.
Yeah.
Just to get him kind of ready. He bloated a lot with fluids. Like there was a lot of going back to just, you know, not going back to it. You sort of see this like experimentation
Yes,
a
of
little
course.
bit, or like no one's really sure, I think, what's going on in pediatrics, because you're dealing with a nonverbal infant who can't quite communicate. And so you're looking at the mom, kind of saying like what's normal,
It's
what's
even
What's
not.
not, and that's a
How we
lot of
talk-
pressure on mom too.
Yeah.
Yeah.
And
NICU
I was just
nurse, how like babies are just their own world. Like,
Yeah, they're also
Right.
different. Very
Yeah.
much so. Yeah.
So I never left his side for like the first 7 days. Like I just lay in bed with him, and he just nursed, like I felt continuously. And
That's so nice that you could have that comfort in between the two of you.
it
And
was,
that's-
it was like him and I in like a weird space, like where I feel like I just tried to communicate to his soul, like stay with me, you know? I know. And there's nothing you can do to obviously
Yeah. Yeah.
assure that outcome. But I just remember that being like
We don't know what this looks like, but I
Yeah.
just, me and you
like,
against
please
the
stay.
world.
Yeah.
Oh.
Yeah.
That's beautiful.
How is he, like, he's so young?
Yeah.
How, like, obviously he likely didn't have a lot of understanding about what was going on. He was being moved and bothered a lot. Like, how was he?
He was pretty out of it, I would say. Like, he was awake, but
he was just
quite
healing.
like
Lethargic.
lethargic, like not putting up a fight to pretty much anything. So it was nice to see that by the end of like our time, like leaving, he was starting to kind of come back to life a little bit.
Yeah.
I'm sure that would be very scary for you as a mom to go through that and kind of witness that for your child.
And of course, it's minute by minute, hour by hour, day by day in there. It's not a linear thing.
That's right.
You know, you kind of groove with how things are thrown at you or how they come, right?
Yeah.
Especially if you said he's been so up and down with how he feels. That's
and that was advice that one of the like CCU nurses gave me, was just like, just take it, you know,
you can't,
minute by minute. Sometimes it's just like, you know, every second, just breathe and get through
the next bit.
Yeah. Yeah. Like the next set of vitals, the next blood draw, the next whatever. And then the anesthesiologist I had for our first lumbar puncture. So there's a lot of those with leukemia treatment because they put chemo into the cerebrospinal fluid.
Yeah.
He was just like an angel. Like there's so many little pieces to our story. Oh, I should tell you just the sailboats thing.
Of course.
He was just like, it's a marathon. And he was like, just breathe, mama. And he was just very kind and like looked in my eyes and connected. Whereas everyone else is like, also it's COVID. So people are wearing like
PPE.
full on PPE. So it's like, couldn't see anyone ever. It's like face shield, mask, gowns.
No expression, which I think nonverbal gestures in these moments are so important.
Yeah. So that was really key. So the sailboats thing. Okay. So this was weird. But the night
we love weird stories.
We love it.
We rolled in. So before I knew he had leukemia, we're getting rolled in through like the ambulance entrance back ways of the hospital.
By the water there.
So two things happened. One was that I recalled one of my very first patients that I had ever had, and I just like had continued following her through Facebook. I knew that one of their kids had leukemia, and they had used a hashtag for her, and it was kisses for Keaton.
Okay.
And I just thought of that, like that thought came to my mind, and I was like, what if I need something for him? Like, what's an S? And I was just like, okay, like sailboats for Spencer.
Yeah.
Just this weird thought.
Yes.
And then the second thing was that, I'll explain more about that later. The second thing was like, the only thing I remembered going into the elevator was seeing the words, Spencer beat all the odds. And I was like, the next day, I was like, what was that? So I ended up talking to one of the nurses when I remembered it a few days later. I was like, I swear I saw in an elevator these words. And she's like, I'm going to go check. And like, sure enough, there was like one of those elevator posters.
Yeah.
It was about preemies. And it said like,
I think I've seen
Elizabeth
that.
Spencer, like blah, 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 blah.
Yeah.
Continued to beat all the odds. But the only words like my brain zeroed in on was like those words. So I was just like, these little signs, right?
Yes.
Of like, that got me through. So then the sailboats thing, you know, I've never really been to Kingston.
Yeah.
I wake up and we're in like, the hospital's located on the water. It's beautiful. And the pediatric rooms all have like these beautiful views of the lake. Wake up and it's just like, this hospital's covered in sailboats. Like there's sailboats passing by outside.
Yes.
There's like there's sailboats on.
And there's
like,
a beautiful
wing.
sunrise that comes through too.
Yeah. So sailboats really became like our thing for him, and like that hashtag. And then people, I would say all over the world, because like there's a handful of people who would like go on vacation and see a sailboat and like send it to us, and it just turned into this.
It's so meaningful to know like that.
sunflower.
That you have like all over the world that you have such a community behind you of these strangers that are coming together to show their support, that you're really not alone.
And it was just this odd thought, like, why would that person come to my mind before I even knew he had leukemia? And and it was just like, okay, this is a sign from above that, like
there is so many signs if you open up your senses too, eh?
And I'm very much like, that's kind of how I
it's a comforting thing. You're looking for signs. Now I'm always like, if you see a sign with Gwendolyn, I'm always like, thanks baby, you know. And it's so true. When we had our Jenny on, the medium, and we're like, is signs a thing? She's like, oh my God, like, absolutely, be open to them, receive them, right? That's the universe, that's above telling you. And like a prayer for people, because people would pray for him or think of him, like send so
positivity.
beautiful.
So you'll never see me like without, like, I have so many charms, you know, people gifted me things. And
I know. And Katie's made this remark, like, you're not going to deck your house in sunflowers, are you? And I'm like,
it's going to be the sunflower.
Well, I might just, like, abso-freaking-lutely, right? Because it's your way of, it just brings, I don't know what it is. It's your symbol.
Closeness, I guess.
Yeah.
Right?
It's your symbol.
Comfort.
And it brings you happiness.
And for us, some of those, like, moment to moment times, to bring it back to that, like, we would be in like a really tense moment or whatever, and I would just like look out at the window, and like a sailboat would enter on like the horizon, and I'd be like, okay, like thank God, like I can do this.
I just need to be grounded with that.
Yeah.
Wow. I love that.
So
story.
that is so beautiful. I love that. I love that for you, because I know how it is to relate to a symbol. But so you're discharged after 2 weeks, you said?
Yeah.
And you're home. What does home look like now after receiving this diagnosis?
Yeah, it was a bit crazy because I have obviously like had the
two others.
boys.
Yeah.
Never been away from them.
And they're not young. Like, I feel like they have an understanding.
Yeah. And
Kinda.
they weren't really able, like they were able to come visit us once, but like
COVID.
everything was quite like jarring for everybody. My mom had come to spend the time with my husband just to kind of like help out and keep things going. But yeah, it was weird. And I just remember, you know, being like very grateful for them.
Absolutely.
Obviously. And like, I didn't yell for a really long time
Yeah.
about anything.
Yeah. I love you,
so
little
I'm
extra.
I'm just gonna be like the best mom ever now, you know?
Yeah.
But it was a tough summer last summer. You know, I think it was a good 4 months of just like, as soon as we were home, like we could get readmitted. And like that did happen many times. So anytime when you're in chemotherapy treatment, if you develop a fever.
Okay, I remember saying that with you a lot. Yeah.
We have to go in and do blood work. And so in those initial phases of chemo that were really, really harsh on his bone marrow, his white blood cell count would be so low. So it's called like neutropenia.
Yes.
When your neutrophils are below a certain level.
Okay.
So if he was below, you know, this certain threshold, it was an automatic 48-hour admission.
Wow.
And they need to do blood cultures and like basically monitor for an infection. Because I think one of the number one reasons kids don't make it through treatment is infections, right? Because they have no immune system, and so no ability to fight it off. And so then you'd just be getting these like, so many times we had fever admissions during his neutropenia. And so it'd be like these harsh antibiotics. I think I might have even had like the hardest time with that, because again, going back to the gut and naturopaths, it's like one round of antibiotics can just like
really
wipe out all your good bacteria. So I'm just like, this kid's gonna be like, he's never gonna have a normal gut, right?
Yeah,
like
absolutely.
Those were some of my thoughts.
How do we restore that for him?
Yeah. And so that was like, it's still a point of like, I think, conflict or misunderstanding between like our oncologists and like that world, because they're sort of against the idea of using a probiotic.
Okay.
Whereas I'm just like, what? Like that's,
but why not?
That's wild.
Yeah.
I mean, I think in theory, because probiotics are living organisms, right? And so they are bacterial strains. When you have a child who's so immunosuppressed, like, is there a potential threat to using them? And so I think this is where a lot of like the conflicts I had with the system is where there's like a lack of understanding or education or research or evidence for utilizing
more natural things as well.
And natural
why can't we do
things? There's sort of like this blanket, like, no, don't do it.
Yeah.
And I
but
think
it's super black and white too. It sounds like it's like one or the other.
Yeah.
And a lot of that is just like, that's not part of their training. And because it's like a very evidence-based model, which it has to be, right? To use chemotherapy drugs. I think everything kind of gets put in that same category.
Absolutely.
And so, you know, we very quickly did enlist the help of a naturopathic doctor in Toronto who's like well-versed in pediatric oncology. Like made sure he was someone who was like respected by sick kids. So those were all things I put into place so that, you know, I was always prepared for a fight at the beginning.
Yes.
I'm like, just so you know, like we're going to have a naturopathic doctor on our team. And thankfully our oncologist was always super accommodating and very open.
I just should be receptive to it.
So that was amazing. She was just like, of course. Like, of course you can do that. And like, I actually know of him and have been to one of his lectures.
Beautiful.
So
what's his name?
Dr. Mark Fontes.
Okay.
Yeah.
I love Gwendolyn spent a lot of time at Sick Kids, so I have a lot of respect for that hospital. And I mean, they're like the biggest, right? So for him to be respected, it must be comforting for you.
It was, yeah. And again, I kind of just always came at, I think I was feeling very defensive in
Absolutely.
that
Of course
like
you would.
early phase too. So there was like the anger and there was the defensiveness. And I think rightly so, where you come across some doctors just are dismissive of natural remedies.
I feel like even if I say something or with my dad, I'm like, is there any vitamins or not, like anything that we could be eating for inflammation? As we know there is. They're like, no, I mean, like you could do this. He could take vitamin C because he's on a drug that cancer patients take that helps with, combating the immunity because he's developing something like his immunity is fighting back, like, as you would know.
Yeah.
And so he has to be very careful with his blood work and, developing an infection as he could be more easier of getting to that point, just like your son kind of thing. And I would say to them, what else could we kind of target this with the other meds? And they're like, oh, I mean, I don't really think much more than that. And I'm like, but there is.
But there is.
What do you mean?
I think that's where like this advocacy piece for me is like starting to come through.
That's beautiful. You're turning your pain into a purpose.
Yeah. And it's like, because of that like perspective that's widespread in the medical community, like they're not necessarily offering options or saying like, go see a holistic nutritionist, go see a naturopathic
see
doctor.
about this.
Like seek out these different modalities. People aren't necessarily going because they're like, my
don't
doctor
know.
said it's not going to work, or they said there's nothing else that we can do.
Yeah, there's not. Yeah, that we'll just utilize this.
So it's like that's not true.
Or they don't even know about it, right? Or
they don't know about it, like you said.
Education too. Do you have like, do you run like through your practice like Instagram, where you have like, yeah, okay, we'll have to share Instagram and the platform that you have, because it sounds like obviously you're doing a lot with it. And does Spencer show up on that page a lot then, or
he does? It kind of turned into a Spencer journey.
But people want to know and they want to be able to stay in touch.
I was never good at being like super informative. Like my style, I think, is just to share my personal life and experience, and my practice has certainly evolved. Like
absolutely,
even like the doula work was more so when I was having my babies or I wanted to get pregnant, and then it sort of evolved into, I treat new moms and I treat kids.
Absolutely.
We continue to move down the line. Of
It's crazy where it goes. I remember having the platform with Gwendolyn before she died, and it's nice to be able to just relate to like medical moms or moms who are in the same situation as you, because I find they're more support than people that you've known your whole life, just because they can relate so easily. And then I questioned a lot. Well, I don't have Gwendolyn, so there's no point. But then it was like, no, we're going to make something out of this now, and help others that have been in this situation and keep going through this journey. So I can appreciate like that evolving of what you're doing now.
Yeah.
I want to know how Spencer's doing.
Yeah. Yes. How is he doing now? So with all the summer was a hard one, you said, but
so he had lost like a ton of weight. He didn't walk till he was 20 months. He was about to walk at 12 months, sort of on track with
absolutely
his brothers, and that might have been another sign in retrospect that he could have had some pain. And so then there was a lot of like muscle loss and atrophy.
Absolutely.
And he looked like a quite sick, I joke
it's so
and
easy
think
to see in like hindsight, right?
Yes. Yeah. In hindsight, like again, we talked about our coping strategy of humor.
Yeah.
My kids last year for Halloween, they're like, Spencer could go as Smeagol, like Gollum for Halloween. And he totally looked like that.
Yeah.
Like if he was naked in a diaper, he had just like one piece of hair left that I wasn't cutting. Yeah. To me, it looked better than not having any, but I'm like, oh my gosh, I should have cut it. And just let him be bald. But
but I think
now
you're holding on to that.
Like chunky. He was born at 10 pounds. So I would say now he's like achieved his like potential of where he should be on his growth chart. Yeah. He's got his hair has come in blonde.
Yeah.
It wasn't blonde before.
I actually just saw somebody on my Instagram go through chemo, and her hair was light and it grew back dark.
Or like a different wave pattern.
Yeah. I don't know why that happens, but that was something we were told. It's like, his hair might come in differently.
Yeah.
And
that's crazy.
it's not super different, but it is still like definitely different. He doesn't look like the same child as he did when he ever, got
that you would
introduced to the
expect him to
hospital
be.
system. And he's running. He's like super playful, hilarious. Like just
I think that's so
normal
beautiful.
kid.
No, or 2.5.
He's 2.5.
Yeah. Okay.
Yeah.
And he looks so well. And I've noticed his hair, like it's a beautiful blonde, and he has a beautiful skin tone too.
He is just like he's
a beautiful child.
He's a cute baby.
Yeah. That must be so good for you. And like, you know,
is he in remission right now?
So yes. So again, with leukemia, it's like they get them into remission really quickly and they never really repeat those scans. You just, again, this goes back to kind of like you treat things in the medical world as like categorized.
As they come.
Right.
So leukemia for boys used to be a 3.5-year treatment plan. Now they've reduced it to 2.5 years. Thank God. So it's just standard, like across the board. The tweaking really only comes, it's like you just get handed this massive flow chart at the beginning and it's like, if this happens, then this, like, it's just so
you kind of follow it
delineated. Like there's no, there's not really room for like, again, like this art of medicine kind of idea.
Yeah. Now, is it true that more boys are diagnosed with it than girls?
I think so.
And it's a pretty known.
It's the most common childhood cancer.
Yeah.
So he has ALL, acute lymphocytic leukemia.
Okay.
B cell type. Like there's lots of different types of leukemia.
Yeah.
So it is highly treatable. His is highly treatable.
And like you said, a lot of kids where they face the issues is if they gain infections or they just can't beat those because they don't have any immunity.
Yeah.
Behind that.
I think that's like the during treatment stuff.
Yeah. Yeah.
I mean, to be honest, post-treatment, part of my, again, coping strategy is to not actually do that much research. I think some people do a lot.
I do. I Google everything. I am a self-proclaimed
Dr. Google over
doctor.
here.
I have a pin that says WebMD. What does it say? Jillian got it for me.
Oh my God, that's a genius for you.
Like it's something like I'm like a WebMD doctor or something.
Very much so.
No disrespect.
Hypochondriac.
Yeah, that's me. That's me.
Which obviously, when I look at the internet and what like comes up when you see medical articles, like there's just, it's so much to wade through and to try and like piece together.
Every
story is different too, right?
Yeah. And how it probably relates to like your own practice and how you're treating. In terms of like, I'm not exactly sure, so forgive me for like, I need to be educated. Like he's in remission right now. He's on this 2-year plan. Is there a risk or a fear that this is going to come back? Is it aggressive in terms of that? Will he need a stem cell transplant? Like, I don't know. Like, I've known people who have gone through stem cell transplants and also blood transfusions, dialysis. Like, what will his future look like?
Yeah. So he's had a lot of blood transfusions. That's a very common part of the leukemia treatment because they're basically trying to suppress the bone marrow. So then he's needed like red blood cells. He's needed platelets. Like he's needed all these things at different times when treatment was aggressive. And so, yeah, just to go back a little bit in that first block of treatment, like those up until maintenance chemo, which is what we're in now, it was like IV infusions weekly, if not multiple times a week, depending on the drugs that he was getting in different cycles of chemotherapy. He has a port. So, you know, he has like a medical implant to do all his blood work and to receive IVs. So once he reached maintenance chemo, which was around June, now we do oral chemo every day at home.
Okay.
And he goes in for like lumbar punctures every couple of months. Like there's still some things in the
They
protocol.
haven't just let you. It's not like, okay, you're done with us. Goodbye.
So that's where we're kind of at now.
Which is comforting to know, like you still have people behind you.
Yes.
All this every step of the way kind of thing.
In terms of like long-term management and maintenance, like I think they never let these kids go. No. You know, there's follow-up. He'll be followed up there forever.
Yeah.
Which on one hand concerns me because I kind of feel that when you look for things, you might find things.
Right.
And
wow. Okay. Yeah.
Which, you know,
absolutely.
Some people might find that really comforting. I think for me, given my background, I'm sort of like a leave well enough alone type of person.
Okay.
Like, especially with the aggressive nature of treatment that like if you were to see signs of a relapse or signs of like a heart problem, I mean, that's the other thing is like chemotherapy is quite poisonous and toxic, right?
Yeah.
So a lot of the stuff that he could face later on in life, any survivor of childhood cancer are the late effects of chemo. Okay. Because that can affect heart, liver, kidney, like it can cause secondary cancers. So all of that stuff will always be managed and monitored. Yeah. This is where I don't do a lot of research. I'm like, I don't want to know.
That's beautiful though. These enjoy potential
these, because then that just causes
adverse effects.
Stress.
That's right.
Right. Yeah.
Enjoy. Yeah. And I'm
not a leave well enough alone person.
Yeah.
I think you've probably put that together about me.
It's funny because my boyfriend is very much like Caitlin. It's like I'm dating the same people, but
I do feel like he is the male version.
Oh,
of me.
absolutely. And that's why I'm so in love with the both of you, I think. But it's funny because
it's weird.
The hypochondriacs, like I'll wake up to him like Googling symptoms at 12 in the morning. And I'm like, what are you doing? And he's like, I can't breathe. And it's almost like he's putting himself into this scenario. He's going to hate that I'm talking about this. But I'm like, wow, like you're actually putting yourself into this.
I went into the doctor's office and said that I'm having dysphagia. And like, yeah.
Was that today?
No.
Oh,
but,
okay.
I
like,
bring medical terms too.
Yeah, and you'll message me and you'll be like, I think I have this, and I'm like, but where did this come from? But so yeah, you have to almost live in the moment when you're faced such a huge challenge. And it was the same with Gwendolyn. Like, you know, I was never guaranteed anything with her. I was lucky to even have her after 19 hours old. So when we would receive new diagnosis, and it was like every fucking day it seemed, and of course I would. At first, the initial was, I was like panicked. I was like Googling, I was bawling, I was angry. I was trying to like not surrender to whatever it was going to be next. But then those moments, and I'm like, but she's so happy, you know, like, and I'm sure with your little guy too, there's times and there's like,
that time and be
why
present.
do I want to like sit there and dwell on something when I can just for a moment take that in?
Yeah, it's a balance, right?
Yeah.
Because at the same time, like I wasn't prepared to treat him myself, right?
No,
so that's why we enlisted the help of this naturopath.
Absolutely.
One of my goals was knowing that there was, you know, going to be taking all these medications that could cause nutrient depletions. Like I wanted to make sure we were on top of like supplementing him and doing the things to counteract as best we could, you know, harmful effects. But so that's why I think you need to build that team around you.
Do you still have a connection with that doctor now?
Yeah.
I was going to say like it's
evolved.
Yeah, that's wonderful.
I think I'm actually like ready to kind of move on to another naturopath, maybe kind of like looking at different things.
Yeah. Yeah.
Because we're all, I mean, just like every person, we're all different, right?
Yes.
Like we all have different strengths or areas of interest. So I feel like my next phase with Spencer will be more like looking at like detox and like long-term,
you've, I'm sure, learned a lot from this doctor that now you can take and get new opinions and get new ideas and a fresh perspective. No, that's wonderful. Yeah. And I know too, like I've seen on Instagram, it's like sponsored by Instagram. I've seen on Instagram too, like stories, and I'm like, you can let me know if it's true or false, that people can, maybe it's not cancer, but well, I guess, cancer, because we've already talked that you can cure certain things, but people can cure cancer with just home remedies and like another route, right? Do you know what the question, like, does that make sense? Like,
I think it's definitely possible to heal cancers with alternatives. Like that is possible. Yeah. It's so complicated, right?
Yeah.
Like,
and you can take, I think there's definitely, you can also,
I would never say that though with a brush stroke. Like the level of commitment, courage, belief, and like, like the, changing of your lifestyle, right? And like, again, it goes back to like that root cause thing where it's like, you need to know what that root cause was, because if you just like, and same with me, right? Or anyone who does chemotherapy, it's like, just because a cancer or the problem is gone, if the conditions in which that condition like emerged are still at play, like something else will happen down the line.
We're just waiting for something to happen.
Manifestation. But so, I mean, I don't even, I feel like for me, that's not even like an area I really thought too much about.
That was a deep question.
It was, you threw me off there.
I don't know. It's just because, like, I mean,
I think, we're more self-aware with our health now, and you see so many things like living that natural.
There's that woman who like preaches, and like people go to her seminars all the time, and she talks about like, she's very food specific. And how like what each food does for your health and each area of your body and inflammation and all these things. And also talks about like, now what's in our food. But we talked about this first too. And I do find like to want to be healthy, to execute a healthy lifestyle, it's an investment. It's more expensive. It is, more work, more time consuming, but it definitely, like with the way the economy is right now, it is much more expensive. Like, how do you feel about that? Like, you know, what do people do in those? I see people do, like, make their meals every night, and it's like, people can't afford to always live a life like that, right?
Yeah, I definitely think there's like societal issues that make healthcare inequitable or inaccessible. But I also
people have to choose the route of, you know, traditional medicine or not, right?
Yeah.
And again, access, you know, where they are, rural communities may not have access to any of this.
I think like what would be an ideal solution, like scenario is like if we went back to, you know, like cleaner foods, like whole foods, more autonomy over like our food supply, right? Like local gardens and local farmers, right? Where you're not getting charged like an arm and a leg for groceries.
Yeah, taking
food
Saturday
that's
morning.
like devoid in nutrition, and yet like that's what you have to kind of buy because that's what's
absolutely
available. Yeah,
I know. Like we could really go down a lot of like rabbit hole topics to try and unravel like how do you do it. But I
it's
think,
true. Yeah,
I think there's always something you can do to improve your health.
Yeah,
even without money.
Whether it's more water intake.
Exactly.
Whether it's a better
more
sleep.
sunlight.
Sun. Yes.
What do you do if somebody's sick every day and they don't want care? It's not for me. I'm not asking for me. But what, like, do you ever experience like people like they're coming to you for a family member or something like that like, you know, or somebody that's not able to right now like really take care of themselves? Like, how do you implement strategies for those people?
I feel like there has to be like a willingness to change, right?
How
like
do
if
I
there
get
isn't,
somebody to be willing? Like,
well, when my first two were younger, I feel like I got into that like very common like new motherhood scenario of just like feeling completely lost, feeling completely like, and that was like probably a culmination of things of like not taking care of yourself, not exercising, not eating properly, never sleeping well.
Get into that routine.
You just
Kids
get into this
you,
like
that's what I'm in
like
right
you're
now.
a shell of a human was how I felt. Like I'm not who I thought I was going to be. So it was almost like a hitting of rock bottom that happened at some point where I was like, okay, like I have to start implementing these self-care things that I care about for my kids. You know, I'm sure like all of us, you know, you wondered about like, oh, is my child getting enough sleep? Are they getting fruits and vegetables? Are they getting time outside? Or are they sitting in front of YouTube all the time? You know, like you consciously sort of think about those factors. I feel like it was, for me, it was just recognizing I needed to turn that on me.
Absolutely.
And just like
kind of like fill
basic,
your cup up, right?
Like, but on like the most bare bottom, like level of
it's
like,
a lot of work though. And I heard this expression and I think about this expression so much because I feel like it's so true that you would die for your child. No problem. Die for your child. But would you live for your child? And in terms of healthy eating, taking care of yourself, all those things, right? So I always thought that was a really powerful expression to put in perspective that like, no question asked, you die for your kid, but like making those small changes to live a healthy, active lifestyle sometimes seem like so big. And
it doesn't have to happen all at once.
Yeah.
Right? Like it can happen like with little steps. And they develop into bigger steps.
Yeah.
I love that. Living for yourself. You would die for your children, but would you live for yourself?
Right.
God, that's good. That's the quote of the day.
I was just thinking that.
I was like, we didn't get a freaking quote of the day. That's our quote of the day. Yes.
I feel like we need to have you back for round 2, but
no, we can do this. I'm a huge believer, obviously, on grief. I mean, navigating grief, advocating grief, talking about grief, making it not such a scary thing. And you yourself have been probably dealing with grief since the diagnosis of Spencer, you know, receiving that diagnosis is grieving a healthy child.
Yep.
And grieving what it should have been and what it was supposed to look like.
Yeah.
Would you agree with that?
Yeah.
How did you handle with grief? How do you deal with grief? Still, I'm sure there's at times where you could get kind of tagged into the stages of grief.
Yeah. I feel like, you know, there are obviously the different stages. Sorry, I'm just trying to like put myself back into certain,
because you go back in them and then you relive them and then you go back again.
Bit, right?
Yeah, because I think your body or your brain kind of tries to compartmentalize like the trauma of when you were like when I was really in like those really tough moments.
Yeah.
I did find like sharing became like a very helpful tool.
Yes.
Right.
You know, at the beginning, I wasn't sure what to say.
Yeah.
I was embarrassed as well.
Because you almost think people will judge you like, oh, she's just trying to get attention for this.
That's right.
Or
there was that layer of
absolutely.
like, oh, why am I? Yeah.
Why do people care about my situation?
That's right.
Yeah. Yeah.
There was also some shame of being a naturopathic doctor and having a child with cancer.
Yeah.
Like, what did I do wrong kind of thing was a part of my,
Absolutely.
but ultimately getting through that.
Have you let that go?
Yeah.
For yourself?
Good.
Yeah.
Good.
For me, finding meaning
Yes.
and finding more, like, I think in the cancer world, there's another sort of like component that I'm not a big fan of is like the cause is genetic. It was not you. It's just bad luck.
Right.
And that explanation might work well for some people, but I was like, I don't believe that,
Yeah.
you know,
Yeah.
like there was something. And so kind of going on this like bit of a pursuit of like, was it environmental? Was it
Finding
an
it.
exposure? Was this like, I went to see an astrologist and to try and glean information of like, was this part of his like life plan? You know, like just seeking different perspectives to eventually come to terms with
And have peace.
the why.
Yeah.
And that was a big part of like, I guess my grief healing.
Do you find sometimes you still go back into the whys? Maybe not as much as once, but
I guess because we're in a phase where life feels so normal that
Yes.
I'm like trying to just sort of be in that.
yeah, absolutely. And that's one way of, healing yourself is, reconditioning your brain into what to think. Because for so long you were conditioned to this cancer mom,
especially
essentially.
in what you do, right? You're almost trained to guide yourself through it in a way.
Yeah.
And so I feel like I was just very lucky. Like I was super fortunate that I had so many people just in my natural like friend network.
I was going to say that
who
your
are
support
healers
network
and therapists and
Right.
homeopaths. And so I had all these people kind of like at my fingertips.
Yeah.
Which I think like what I wanted to say too about, when you asked about treating cancer, I feel like a natural resistance to that. It's like through this journey, like people have asked me, like, is this something that you want to work more with? And it's not really like the people I want to continue to work with, which is why I wanted to be a doula and why I care about motherhood.
Yeah.
It's like, it's always goes back to like the caregiver for me.
Right.
Yeah.
And it's like,
And those connections and
and if the mom is burnt out and can't take care of herself because there's a sick child or even just a busy lifestyle of 2-3 kids, whatever.
Oh, yeah.
Like if they're losing themselves, like eventually that's going to like,
Dribble off into the next.
Other
Absolutely.
areas.
We talk so much about that, like how the heck do moms just do it in general, but being a medical mom too? Like how do you do?
And that's the thing. We just had this conversation because my son right now, now that he's got his AIDS, he's we're on a speech journey now. Like I say, like his hearing journey, like, we go for mapping. We do all those things. We do our audiology checks every 3 months. We see infectious disease for him. And I feel like we're on this like speech journey now. So we have 4 to 7 appointments every month. So we alternate sign language every 2 weeks. We have speech therapy every 2 weeks. And then we usually have like an audiology visit or we have to go to the hearing aid clinic or something like that. And I am so fortunate to be self-employed and now working, again from home. But I say all the time to Tamara, like, if I had a regular job, how could I commit that? Like we travel to Chio, we travel to Hotel Dieu. Like how do parents who need more care, who need to stay long term in the hospital, like how does
I remember
it's a full-time job to clean my house, like
I remember meeting with my students in the hospital bathroom in between procedures, just because like I couldn't afford not to be like miss work, and I could not be with her. So it's such a thing that I feel like needs to be looked upon. That's a whole other discussion for another day. But so again, like
I want to leave it on.
Yes.
I want to leave it on because now you have,
I want to, okay, I want to add something too, like before I want you, how can others support someone they love when dealing with a medical diagnosis like yourself? And then were you going to say, Katie?
Yeah.
That's what I think.
No, that's lovely. That's great. I wanted to know because you now obviously have this platform. You obviously have a practice that you're promoting here as well. And I guess I just wanted to, to know like how people can connect with you as well, like going forward and follow your journey and things like that.
Okay.
Two-parter.
A two-parter. I feel like I have to answer the second one first because it's more fresh in my mind.
Perfect.
I'll remind you.
I am most active on Instagram.
Yep.
Like most of us,
like
right?
most of us. And
As you can tell, I'm a big fan.
yeah, it is a great, for all of the negatives, there's so much positive that comes out of it.
Yes.
And like, that's been my primary source of developing community through this journey.
Absolutely.
So you can find me there. It's
Yes.
Dr.Jackie ND. And then I have a website as well.
I tagged you in something tonight and it came up as like a county.
I do have another account
Okay.
that has been pretty much dormant since this all went down.
So don't follow that one, but we will provide a link to your handle within the video, as well as the Spotify page.
Yeah, it's not dormant. I need to bring it back. but
Yes,
it's
of
just
course.
Sort of like,
I don't know why it came
my
up. It
whole
was
career,
weird.
went sideways when
Yeah,
this all
of course it did.
went down. So I could only manage.
So now
the
you're
one
remorphing
account.
yourself, which is beautiful.
Yeah.
That's amazing.
And I have a website.
Yes.
I can send you the link to that.
What
as
is the
well.
website?
It's drjackie.ca.
Love that, Dr. Jackie.
Dr. Jackie.
And how, the second question was, and we'll wrap it up with this, is how would you support somebody that has just received a diagnosis? What would you?
What was most helpful for you? What have you taken away from that experience?
Yeah, to be honest, like it was realizing that anything matters. And I got like gifts and cards and notes from people that like I didn't even know knew about me or cared at all about the situation. So I think it was just, if you know of somebody who's in like a tough spot, whether they like lost a parent or, going through a divorce or a medical diagnosis, it's like, you can do anything. And I did a post about this recently that I'm like one of those people that's like really awkward, I feel, in like knowing what to say or grief situations or
because we feel like we need to fix it,
like
right?
should you give flowers, should you give this? And like sometimes I got like a bag of popcorn and like like you might be hungry in the hospital and I was like, wow, like it's just so nice that people thought of me or cared. And so not that gifts are the be all and end all, but it's just like that knowing of like
You're being thought of.
You're being thought of is
and just
really,
knowing that nobody's trying to fix your situation, they're just there.
Because it was so isolating, but just to know that people like, people were thinking of him.
Yeah.
And I and our family like gave me just a lot of
A little bit
like
more of a push to keep
warmth.
going.
yeah, like I can keep going. Or
I got
there's
this.
it was like little pick me ups throughout that was really
Oh,
hard.
that's beautiful. And I'm
That's
just looking at your
amazing. I love
sailboat.
that.
All right. Well,
Sailboats for Spencer.
sailboats for Spencer.
That's right. That's a whole hashtag.
And just a reminder, guys, to like and subscribe to our YouTube channel. And
We'll see you next time. Thanks, Dr. Jackie.
You're welcome. Thanks for having me.